I'm Bobbi Fischer, and this is my Aesthetically Awkward Podcast, a show where we dive into all things aesthetics, health, wellness, entrepreneurship, and everything in between. This podcast is for informational and entertainment purposes only. It is not medical advice. Please consult your own healthcare provider before making any decisions in your personal health journey. Now let's get into it. Thanks for tuning in to another week of our podcast. Today is going to be a little intro into CO2 laser. It's one of the most powerful tools that we have in our aesthetic practice. My goal is to walk through what the CO2 laser is, what it treats, how we use it, the difference between fractional and full field ablation, the contraindications, what the downtime's like. We'll also talk a little bit about planning with different modalities, our signature stacks with combinations like PicoLaser, Pixelate RF microneedling, and biostimulator injections. We're going to talk a little bit about how we use it for vaginal rejuvenation as well. Before we get into the nitty-gritty, we are going to go behind the mic to talk about my flex or flop for the week. This week is a flop. If you have been listening to the last few episodes, you've heard staff interviews with Isabel, Trinity, and Amber, and you're probably wondering, why didn't we hear an interview with Katie? Katie has technically worked here longer than anybody else. She was scheduled to be my very first interview. We ended up having to reschedule because she had oral surgery. So understandably, she didn't feel up to doing an interview right after she had her wisdom teeth extracted. She was swollen. She was bruised. So we ended up pushing it back a couple weeks. And then I went and had surgery on my eyes. I had LASIK surgery, and I'm still recovering 3 weeks later. I unexpectedly had a bilateral subconjunctival hemorrhage. So I really didn't feel up to being on camera myself. And if you look close enough, you can probably still see some of the blood in my eye. Well, I just did not feel up to doing a podcast when we rescheduled. So she's pushed back to the end of the month. I'm probably going to have just a couple of solo episodes these next couple of weeks. So bear with me. Let's get into our laser conversation. So what is a CO2 laser? The CO2 laser emits a wavelength of 10,600 nanometers. The wavelength is absorbed by water in the tissue, which leads to vaporization. CO2 lasers are considered to be ablative lasers. That means they remove tissue and deliver heat to surrounding skin. That plays a role in triggering a response that leads to skin remodeling. So we're creating an intentional controlled injury to the skin. It's removing the damaged surface tissue. It delivers thermal energy into deeper layers. There's an inflammatory response happening, and that's causing your body to repair itself. Fibroblasts are activated, and fibroblasts are cells in the skin that are responsible for producing collagen and providing structural support. Their activation leads to the tissue repair. Something else is happening called neocollagenesis, which is just a fancy way of saying formation of new collagen. It's not swelling or short-term tightening. It's the actual gradual production of healthier, more organized collagen. That takes place over several weeks to months after treatment. And that's why the CO2 laser results continue to improve over time. You may have heard some terms like fractional versus full field ablation. Full field ablation treats nearly the entire epidermal or the outermost layer of tissue. It carries longer downtime and also has a higher risk of infection and hyperpigmentation, scarring, but it can be appropriate in some instances for severe sun damage or deep wrinkles. It's only performed in carefully selected patients and generally is only performed under sedation by a skilled surgeon. We perform fractional CO2 in our clinic. We can adjust the settings for very, very light ablation versus a more moderate ablation, but it's still fractionated. And what that means is we're only treating a certain targeted percentage of the skin. You'll see a grid pattern. So in between the treated areas, there's intact tissue that's left undamaged. This creates like a bridge or a column between the tissue, and it allows for faster healing or re-epithelialization, and it helps reduce risk of complications such as hyperpigmentation and scarring. You'll hear terms like cool peel or cool CO2. Don't mistake that to mean that there's no downtime, no discomfort, or no risk. It just means that the injury that is being delivered is in a more controlled pattern. Some of the indications for CO2 laser when we are treating the face. I use it for acne scarring and textural irregularities, fine lines, deep lines, photo damage or sun damage, sometimes skin laxity. Only very mild skin laxity, though, usually that crepiness around the eyes, or even just slightly in the lower face. It's not going to take the place of surgery. We're not going to yield surgical results. If you need a blepharoplasty, or if you need a facelift, or if you need a neck lift, get that done. You're going to see minimal results from this. It's only going to help tighten and firm up the tissue that's there, but it cannot replace the need to having that excess tissue removed by a plastic surgeon. Fractional CO2 is often used for atrophic acne scars. If you go into PubMed or other literature databases, you can look at randomized split-face trials where they treat one half of the face on acne scar patients, and there is meaningful improvement that you can visualize. Those outcomes are going to be heavily influenced by the settings that the operator uses, the technique, the appropriate patient selection, and the aftercare. All CO2 lasers aren't created the same because they're manufactured by different companies, but if it's a fractional CO2 laser, you can achieve similar results by tweaking the settings, making sure that the appropriate patient is selected, good aftercare instructions to avoid risk of hyperpigmentation or infection, prepping a patient in advance to make sure that their skin is ready for that laser, and understanding the settings and the energy that's being delivered to the tissue. All of that's going to influence how good of an outcome a patient's going to have after a CO2 laser treatment. Contraindications. What kind of patients are not a good candidate? Anybody who has impaired wound healing, so those on immunosuppressants, uncontrolled diabetes, anybody who's recently used isotretinoin or Accutane, anybody who has an active skin infection. If we think that you have an inability to comply with aftercare, if you've been in the sun, or if you've been using a tanning bed or self-tanning products. Melasma-prone skin, which is not an absolute contraindication, but if you are somebody who has melasma or you're at risk for hyperpigmentation, pretreatment is necessary. We need to precondition your skin with something called a tyrosinase inhibitor to help reduce your risk of getting that rebound hyperpigmentation. If you have a history of cold sores, we need to treat you prophylactically, and we cannot treat you if you have an active cold sore outbreak at the time of your scheduled procedure. CO2 laser is generally contraindicated in darker skin types, and it's because of how the laser energy interacts with the melanin and how darker skin heals after a thermal injury. While the target is water in the skin, not melanin, the melanin is going to absorb some of that energy. So in darker skin, where melanin is more abundant throughout the epidermis, more heat is going to be absorbed in the wrong place, which is going to increase the risk of excessive thermal injury to surrounding skin rather than just to the intended treatment zone. That's going to kick off melanocyte overactivity during healing, leading to a much higher risk of post-inflammatory hyperpigmentation, prolonged discoloration, uneven tone. It could even lead to hypopigmentation, permanent lightening of the skin. There's also a higher risk of delayed healing and scarring. Darker skin tends to have a higher inflammatory response. When you combine that with the deep thermal injury from an ablative laser, wound healing can become less predictable. It doesn't mean that the CO2 can never be used on darker skin types. I have used it on some darker skin types that are well conditioned. I adjust the settings. I'm very conservative with the settings, always fractional, never fully ablative. Strict pre- and post-treatment instructions, very, very careful patient selection. There are better treatments for darker skin types, such as RF microneedling, PicoLaser, or Q-switch devices, 1064 nanometer wavelength. Those will all stimulate collagen while minimizing the melanin-mediated complications. We've talked a bit about it already, but I want to make sure that we talk about the risks. Risks include prolonged erythema or redness and swelling. It could cause an acne flare-up. There's a risk of infection if you don't follow aftercare. Oral cold sores might be reactivated. Post-inflammatory hyperpigmentation, which is where you get that rebound pigmentation, usually of a brown color. And sometimes scarring. Not every patient needs a CO2 to achieve meaningful improvement in their skin texture. If you are a patient in our clinic, you may have received, or you've probably heard us talk about, some of our signature stacking protocols. So these are combination therapies where we combine multiple modalities to help reduce the number of trips that you make to the clinic, to minimize your overall downtime, and to improve how quickly your results are achieved. Layering these treatments doesn't mean that we do everything at once for every single person. We have to be very intentional about this. We have to ensure that the technician and the patient understands how these modalities are working together And it's important to layer the energy in the appropriate order to achieve the best outcome. When we stack treatments, we work from the deepest layer of tissue to the most superficial. Deeper treatments help create that structural change, and more superficial treatments refine the texture and the surface quality. The order and intensity of treatments are customized to each patient's anatomy, skin type, goals, and tolerance for downtime. We might start with a PicoLaser skin rejuvenation treatment, generally the 1064 nanometer wavelength. It's effective for pigment, tone, and collagen stimulation with minimal downtime. From there, we might add microneedling, whether it's Exceed microneedling or Pixelate RF microneedling. Then we might CO2 over the top of that to address texture and scarring and more advanced resurfacing. We're doing that all in one day rather than spreading those treatments out over time. If collagen loss and mild skin laxity are a concern, we might inject biostimulators like Sculptra or Radiesse, and then combine that with a lighter or fractional cool CO2. For patients who need more tightening or structural support, we might do a biostimulator injection and or a Pixelate RF microneedling and follow that up with a cool CO2. Depending on how severe the textural concerns are, we might do a final pass with erbium, either full ablation or fractionated. When we're doing that, the RF microneedling is targeting the deeper tissues, the CO2 addresses that texture, and the erbium allows us to lightly polish the surface with less thermal impact. Not everybody can tolerate this much heat in the tissue. We do have a Zimmer chiller in our office. We offer topical numbing, and we also offer oral anxiety medications. You do need a driver for that if you choose to use that. Downtime is going to vary depending on if you're doing a cool CO2 versus a more aggressive fractional ablation, or if you're stacking treatments. You could have 1 or 2 days of redness to several days to weeks. When we layer these treatments, we can often consolidate downtime rather than creating multiple recovery periods where you're coming back every 4 to 8 weeks for a different treatment. If we consolidate them, you might just be able to take a week or so off of work, and that's all you need each year. The aftercare is also critical. Our focus is always barrier repair, reducing inflammation, cooling the skin, hydrating the skin, and protecting the skin from the sun. We use Epicutis in our aftercare kits to support the barrier and to calm the skin. Generally, after any procedure where the skin is being broken or ablated, we are applying an Epicutis post-procedure mask. Our patients are going home with an Epicutis post-procedure kit that has their oil cleanser, their lipid serum, and their Hivea cream. Now, for a more aggressive CO2, you're not using any of that usually until 2 days after treatment. For the lighter CO2, you're using that about 24 hours after treatment. We are going to tailor that depending on your skin, how it reacts, and the settings that are used. Cool compresses with water and vinegar after laser resurfacing serve a few purposes. It helps with temperature control. After ablative or fractional laser resurfacing, the skin retains that residual heat. It's going to be inflamed. The cool compresses are going to help dissipate or release that heat. It's going to reduce vasodilation, and it's going to help calm that inflammatory cascade. It's going to help improve your comfort. It's going to help reduce swelling. It's going to reduce that redness that can prolong your downtime. It's also going to adjust the pH of the skin. Vinegar is dilute acetic acid. Laser resurfacing disrupts the skin barrier and it raises the surface pH. Introducing that vinegar is going to make the skin environment slightly more acidic, which is going to help restore the skin's normal acid mantle, supporting your barrier and discouraging bacterial growth during that phase where the skin is open. That's going to help reduce your risk of infection. The acetic acid in vinegar has mild antimicrobial properties, and it's particularly resistant against gram-negative organisms. During the first several days after a laser resurfacing, the skin is essentially a controlled wound, and the vinegar soaks are going to reduce the microbial colonization without the effects of harsher antiseptics. Cool compresses are going to help with the tissue exudate, or that sloughing off. You might hear it referred to as MENS. MENS, MENDS, stands for microscopic epidermal necrotic debris. So after a laser resurfacing, the laser creates thousands of tiny treatment zones. They start to migrate upward towards the surface of the skin, and it might appear like a yellow, tan to brown in color. It might look like pinpoint crusting, and you might even see tissue weeping. That ooze is a mixture of necrotic or dead tissue, fibrin, serum, and inflammatory byproducts. It's a sign that new epidermal tissue is being regenerated. It's usually a clear to straw color. As it dries, it can look sticky or shiny, lightly crusted, and it can feel a little gross in those first few days, especially the first 2 to 3 days after a CO2 laser resurfacing. It is normal. You do not want to pick at it. You don't want to scrub at it. That's why it's important to be very gentle with your skin and use the aftercare kit that we send with you. Using those cool compresses and those vinegar soaks is very important here. Those compresses are going to help soften that fibrin and those necrotic debris so they can be released naturally. Those mends are going to shed naturally on their own. If you're using that cool compress, you're going to see it come off on the towel. You're using a clean paper towel every single time, something that is lint-free. Timing for when to reintroduce SPF and makeup after a laser resurfacing is going to depend on the settings that were used, how aggressive the treatment was. It can be a little confusing, so make sure you talk to your technician. Light fractional CO2 resurfacing, which is most of what we do here. It's not fully ablative. It's very superficial. Your skin heals quickly. You can reintroduce a mineral physical SPF once the skin is no longer weeping, oozing, or tacky. That means that there are no longer any open channels on your skin. It's usually around day 3 to 5. When we say a mineral physical SPF, no chemical SPFs, we are looking for a zinc oxide or a titanium dioxide SPF. We prefer the Epicutis Lipid Shield, the Skin Better Science Tone Smart SPF, or the Color Science SPF. All those are available for purchase in our clinic. Another brand is perfectly fine. Just make sure that it is a physical SPF and not a chemical SPF. Safe sun practices and physically trying to avoid the sun matters. You don't want to intentionally go outside and expose yourself to the sun after a laser resurfacing. That's going to increase your risk of getting that hyperpigmentation. And you're going to be at an increased risk of getting a sunburn. As far as makeup, I don't recommend reintroducing makeup until your skin feels smooth again. And that's usually going to be about a week, even after a lighter laser resurfacing. Mineral makeup is going to be best. It's going to be less likely to irritate your skin barrier. If the makeup stings, it's too soon. Take it off. If you are getting a more aggressive, deeper fractional CO2, or you are going to a plastic surgeon's office and you're getting a fully ablative resurfacing, the timeline is going to be longer. You're going to be staying indoors. You're going to be wearing hats, masks, avoiding windows, even avoiding being in the car. Once that re-epithelialization is complete and the skin is pink but intact again, mineral SPF can be introduced. That's going to be closer to the 7 to 10 day mark. Sometimes longer depending on the depth and the patient healing. Makeup here is going to have to wait until the skin's completely healed and no longer flaking. It could be up to 2 weeks later. If you apply makeup too early, it's going to disrupt the new epidermal cells, and it's going to increase your risk of that erythema and pigmentation concerns. Long-term, diligent, daily mineral SPF use is non-negotiable for several months, and honestly, protect your investment. Don't use a tanning bed. Now, I'm not saying don't live your life. Of course, you're going to eventually be able to go to the ballpark again and watch your kids play soccer, all of the things, but we need to be smart about it. The melanocytes in your skin are going to be reactive long after the surface looks healed. That's why there can be delayed hyperpigmentation that shows up weeks to months later if you're not consistent with your sun protection. We've talked about laser resurfacing for the face. I did want to touch a little bit on vaginal rejuvenation. When we talk about vaginal rejuvenation, we're usually talking about genitourinary syndrome of menopause, or GSM. That is a collection of symptoms related to declining estrogen levels and changes in vaginal and vulvar tissues over time. Symptoms might include vaginal dryness, burning or irritation, painful intercourse, recurrent UTIs, changes in the tissue elasticity, a general sense of discomfort. These symptoms can show up during perimenopause, menopause, postpartum, during breastfeeding, or in patients who cannot use or do not use hormone replacement therapy. Fractional CO2 has been studied as a treatment for GSM. The idea behind it is that controlled thermal injury to the vaginal tissue may stimulate tissue remodeling. That helps to improve blood flow. It supports collagen production, potentially improving the tissue elasticity and hydration. We use the Phoenix CO2 laser in our practice, and that's typically done in a series of 3 sessions, spaced at least 4 weeks apart. We have to set clear expectations about this. It's not a one and done. You're not going to achieve meaningful results in just one treatment. Patients are still going to benefit from local vaginal estrogen or DHEA, even if you pursue laser treatment. You might require pelvic floor physical therapy to address pain, tightness, or functional concerns that laser just cannot fix on its own. GSM is usually multifactorial, and treatment works best when it's individualized rather than one size fits all. Aside from the CO2, we're doing local therapies like vaginal estradiol or DHEA, non-hormonal vaginal moisturizers and lubricants, pelvic floor therapy. You can use those with or without CO2 laser, and other practices also use RF or radio frequency treatment. You need to make sure that you don't have any active vaginal infections or sexually transmitted infections. After treatment, pelvic rest is going to be required for about a week. That means no intercourse, no tampon use, no swimming, no soaking in a hot tub or tub bath. Expect some light discharge, which is normal. Gentle hygiene externally only. You're also going to want to have Aquaphor on hand to apply before and after urination. As far as the procedure itself, we start by applying topical lidocaine to the external labia. We use a vaginal swab and hydrogen peroxide to cleanse the internal vaginal canal. Our laser probe looks much like a transvaginal ultrasound probe. This probe is going to be inserted gently to about the level of the cervix. Once in position, we'll retract it approximately 1 to 2 centimeters, and then we activate the laser. That laser energy is delivered in a 360-degree pattern, allowing for even treatment of the vaginal canal. The process is repeated until the probe is gradually withdrawn to ensure consistent coverage throughout the internal vaginal tissue. After we complete the internal portion of the treatment, any topical lidocaine that we applied to the external labia is removed. We degrease that tissue, and then we switch over to the scanner handpiece for the external treatment. We use fractional or cool CO2 settings. This approach is used to stimulate collagen remodeling, improve the tissue integrity, supports tightening of the external tissue and surrounding structures, including the area near the urethra. The goal of this combined internal and external approach is the tissue remodeling rather than surface ablation. Treatments are performed with controlled settings and tailored to your anatomy and your symptoms. CO2 laser is a very powerful tool. When we use it, we have to make sure we're using the right patient with the appropriate expectations, preconditioning of the skin, and the appropriate aftercare. That is what's key to long-term improvement of skin quality and tissue health. Fractional approaches help improve safety, and layering treatments can reduce downtime and accelerate results when done strategically. Patient selection matters and education matters. CO2 laser can be one part of a comprehensive plan, but it usually works best alongside other therapies. If you're local to Danville and you're considering a CO2 laser and you want to know whether you're a good candidate, that conversation is going to start with a consultation. You can book that directly with me or with a member of my team. You can follow me on Instagram at BobbiTheMP_Luxe Lift, or follow the podcast's Instagram page at Aesthetically Awkward Podcast. I'll also link up our contact information in the show notes. Feel free to send me a DM on Instagram if you have any questions about CO2 laser. Appreciate you tuning in again. Talk to you next week.